Hi, and welcome back to the Senior Network. We're now joined by Carey Babcock, Pruitt Health Home Health. Glad to have you.
Thank you.
Great
to be here.
I mentioned earlier, I really like his tie. I really do.
Thanks.
Tell us a little bit about your role there.
I am a community relations representative, and I call on the hospitals here, Hilton Head Hospital and Coastal Carolina Hospital, as well as all the primary care clinics and specialty clinics in the Hilton Head, Bluffton, and Jasper County areas. So I call on them to try to get referrals for those practices and hospitals to refer patients with us that might have chronic health issues, primarily Medicare patients who need home health.
Gotcha. Tell us a little bit about, the services that we talk about treating, like give us some ideas of, like COPD, CHF, kind of describe some of that.
Yeah, absolutely. Any person that is homebound, and homebound means that they cannot leave their home without a taxing effort. Maybe they need someone to come help them. Maybe they have to move with a walker. So that would be someone who's homebound. And different conditions, we can treat almost anything and help them out. Our goal is to get them better to where they feel better about themselves, can get around and keep them out of the hospital. That's our goal. So we can treat COPD, congestive heart failure, end-stage renal disease. I'm probably missing a few here, but any chronic diabetes is another big one.
Yeah, that's a big one.
Yeah.
Well, and I think a lot of people maybe not realize that, the goal is you're getting them out of the hospital and back home where they want to be, right?
Yes.
And that's a big goal of it.
Absolutely, and especially now with the new reimbursement models that CMS is put forth through the Affordable Care Act, the goal of the hospitals is to keep the patient out of the hospital. So let's say the patient might have a stroke or a heart attack and they go in and they get treated. Hospitals are getting penalized if they have to come back in within 30 days to treat that same issue. Oh. So yeah, so there's a financial incentive for the hospitals to keep the patients from coming back. So that's where we step in, and we're part of the continuum of care. It's a big need and a trend that's going with the way healthcare is being delivered today. We can go into their home with our skilled nursing, our physical therapists, speech therapists, occupational therapists, and we can treat those patients at home. They feel more comfortable in the home, and also we can see what their home life is like. For instance, risk of fall is a big issue.
Sure.
Of course, if you have a fall, you break your hip, it can degenerate, your health can degenerate very quickly. So what we want to do is go in and assess their living conditions at home, and then we can see, are there simple things we can do to make their lives easier? A big one is COPD patients. We have a new kit that we give to all COPD patients. It's free to the patient, paid for by Pruitt Home Health. And it gives them little reminders about taking breaths, stuff that maybe we take for granted, but how to inhale, and it sets little goals for them. And it's the stuff that the doctor tells them when they're getting discharged from the hospital that perhaps they would forget when they get home. So we help with medication adherence, just any number of things that will help that patient get back up on their feet.
And a lot of folks may not know that, if the senior population that we're talking about and serving, that home health typically, when they are considered homebound, is covered by Medicare, correct? So it's not out of pocket.
You have to be certified through Medicare.
Yes.
Yes, you have a certification that you go through.
Yes.
Right, it's
and,
not easy process either.
Yeah, we went to great lengths. Also, we just became a preferred provider for Hilton Head Hospital in Coastal Carolina. So we had to submit to them a lot of information about our quality scores, and all this is made available to the public. Anytime you're dealing with Medicare, they chart your scores, patient outcomes and whatnot, and they make that available so the public can make an informed decision on who they want as their home health provider.
And this is really trending. I think I just saw this on the news last night that the hospitals are like, okay, well, I'm discharging you, and they're like excited because they know like a Pruitt Healthcare is coming in, and I know this one lady was interviewed yesterday, and she was like, I can't wait. I want to receive care in my own bed. Yeah. In my own home with my own surroundings. I guess the biggest challenge probably though is setting up the home like a skilled bed though, like with bathroom issues and things like that? How do you get around that kind of thing?
Each patient is unique, and each disease state's unique. We don't have a cookie cutter approach for anybody. What our staff does is they go in. We have very good skilled nurses, very good physical therapists. They'll go in and kind of assess the environment for each patient, and then they can go ahead and evaluate, assess, and then put together a care plan to treat that patient over a period of time.
And even with, I know you folks have a hospice division too, is that correct?
Yes.
Yeah. So I know a lot of times you work with home health kind of trending into maybe hospice is called in too when they're there at that point, right?
Mm-hmm. Yeah, a lot of our patients have home health providers while they sit, because hospice, we have our medical director that goes in certain times, and our RNs and our CNAs and our volunteers, our social worker and chaplain. But if they need more care, more hours in the day, more days in the week, they usually call on a home health facility to help with that.
And Carey, you had mentioned falls, which is a big problem with aging. Do you folks offer like physical therapy and stuff like that in the home?
Absolutely. We have physical therapists that are very good quality scores. They're experienced. And we have a new program we just launched. It's called Safe Path. And what this is our PTs will come in with a foam pad. It's about a couple inches thick. And they will do an evaluation of the patient standing on that pad. Now, it sounds kind of funny because we all have good balance and whatnot, but a lot of times people don't realize their balance is failing until they have a fall. Right. Falls are a huge problem in, with the aging population, and that is most likely what will lead them to the emergency room. So what we can do is go in and evaluate them on this pad, and over the course of, let's say, 6, 8, 12 weeks, we keep chart, and the PTs will score the patient, an initial assessment, and then they will have them do a series of exercises. And it's simple stuff. The thing that got me, because we had to do this when we were going through the training.
Hold that thought. This is important to, we want to continue this. Very much. So hold that thought. We had to take a break.
Nope.
Oh, no.
We're done. Sorry.
Oh, no.
Sorry. Carey, thank you for joining us.
Thank you.
Sorry. Linnell, thank you.
Next series. Yeah, stay tuned in all
And
this.
thank all of you for joining us here on the Senior Network, where senior care experts come together. We'll see you the next time.